For those with right side heart failure symptoms at diagnosis, can medications relieve those symptoms? And also, are there effects on the heart from the time it was strained before being diagnosed and treated?
When we do find that we are diagnosing patients maybe later than we would like, where they are already experiencing symptoms and signs of right sided heart failure, our goal is to try to rapidly get them onto therapies to, again, try and at least slow or stop that progression of the disease. Frequently, while doing that, we see that their response is positive, so that many of the symptoms that have brought them into us start to alleviate to a certain degree. I can't necessarily say that they can be completely relieved. That's dependent on each patient. But that would be the goal, is that if somebody's coming in and they have severe shortness of breath when they're at rest, with therapies and appropriate treatment, that they would start to maybe initially only have shortness of breath when they're now exerting themselves, and then maybe only when they're really exercising. And ideally, it would be that even with exercise, they don't feel shortness of breath. So the goal with these therapies is to relieve those symptoms of heart failure. There has been shown with our research and our studies that with these medications, we can often see improvements in the strain on the heart, typically through an echocardiogram, which is, sort of a picture of what the heart looks like and how it's functioning. And so we are able to see if it is enlarged or dilated, or maybe the squeeze of the muscle isn't where it needs to be. And over time, with treatments, we can see that there are improvements in how the muscle is contracting. We can see that the dilation or the increased size of the muscle is starting to kind of go back into a more normal state. So those would be areas that these therapies have been shown to often be beneficial for our patients.